video, we will start to train the particular region of pelvic stabilizers and pelvic bones and the group of muscles that are stabilizing the SI joint, sacroiliac joint. The sacroiliac joint doesn't have muscles on its own. It has the muscles that are around, or has the muscles around the glutes, hip flexors, and medius glutes on the sides. These are the pelvis stabilizers, right? And sometimes, again, the way how we use them is different, because when we walk, for example, in the walking pattern, this pelvic bone goes back, that pelvic bone goes forward. So our pelvis, every time we move, is moving this way. So if the walking pattern is not correct, this also creates unbalance around the pelvic area. So what is important for the next group of trainings? We will do in two planes. First, we will train in a sagittal plane, where we will be teaching the body, the joints, not only the muscles, but also hip joints, right? Doing forward folds and engaging the muscle group of muscles that is responsible for stabilizing this particular region. So first, it's a very simple move, but we need to learn how to sit down on a chair. Again, to stabilize, make sure your feet are hip distance wide, and once you bend forward, you're trying to engage both legs, both glutes evenly. You sit down. If you feel discomfort, you can support yourself with the knees, or maybe even help yourself to being next to the table. So this is first. And when you stand up, again, just observe, are you standing with one foot more or one side more, or you standing with both feet at the same time? So here what we're trying to do, we're trying to teach the body, we're trying to teach our nervous system and muscles to move synchronically, in synchronicity. So you're making sure, again, the legs are the same, because you may notice that the body has a tendency to lean the weight on one foot more than another one. Or when you sit down, sit on the first buttock, then on another buttock. So just do this little once. So first you can train with the chair, and then you can start training without the chair. And when you stand up, again, slowly engaging both legs evenly, engaging both buttocks evenly. It may take some time, but this is a basic move, but it helps you to really teach your body to keep your pelvis stable. Okay? Again, you can do a few sets with 10 to 15 repetitions. It strengthens your legs, and at the same time, it engages all the group muscles. Okay. For the next exercise, you may use a block, you may use a stack of blocks, or even a simple stair. What we're trying to do is when we step, we leaning the weight forward and engaging stepping on that foot, right? So first of all, we want to teach the body, I'm going to turn it this way, to step up, and again slowly stepping down. So again, keeping the pelvis stable, moving from here, maybe even higher, see how it feels. But the most important is, when you move, to keep your pelvis stable. So engaging the muscles, engaging the legs, engaging the awareness, and then you can do the same way. And again, when you do it, it looks very simple, but you definitely notice that the side that is weaker, the glute muscles, the leg muscles, might be not fully engaging. They might be also feeling a little bit weaker than another leg. The next exercise, we will be doing forward folds with two legs. Again, keeping the pelvis here, we're going to engage, so with the soft knees, feet hip distance wide, bowing forward with straight back. And when we lift up, we're going to again come back, so not with the round back, right? We don't want to overstretch it. We try to go down from using the hip joint, so your sitting bones are spreading out and then coming up again. Again, forward and up. So a few rounds like this with the straight back, so you keep it straight, but again, you engaging in seeing, observing how your legs are being used. Where is discomfort? Are you evenly pressing the weight, distributing weight for your feet? Again, or you're standing more on one side than on another side. So again, you can do it with the pelvis, with the belt. And then what we're going to do, we're going to do the same thing on one leg. So a few repetitions on one side. So exhale, going down, inhale, come all the way up. Again, down and up. Down again, your pelvis is even. The weight is mainly on the standing leg. The back foot is just for the balance. And again, 2 or 3 sets with 10-15 repetitions. And this is the same one. Also, you will notice that on one side, the side where the SI is unstable, the hamstrings might be tighter. The movement of the leg, the inner hips, the inner groin muscles might be tighter. So when you do the forward fold, you may feel contraction or something is stretching or something getting engaged. So this is again our little tiny signals that we're observing, learning, and teaching one more time to move all together. The next exercise will teach you to kind of go forward, so stretching the back line and also increasing this gliding of fascia, muscles and tissues on the whole back line. So you can stay here by the knees, inhale, and as you exhale you can slide with your hands down as it feels comfortable, and then coming all the way up, standing. Inhale and exhale again. Protecting your lower back. So not going with the round back, but keeping the back straight, but doing the forward fold through the hip joints. When you do the hip joints, your sitting bones going up and you will feel a very good stretch at the back of the legs. Your knees, we're never locking, they're always soft. Even me, even my hamstrings are very flexible, I'm still, when I go forward, I always keep my knees soft because it allows me to really engage the whole back line. And coming up. And when you, again, doing this exercise, sliding, again, observe the weight. Are you evenly distributing the weight between 2 feet? And again, a few repetitions as it feels comfortable. And coming up. For the next exercise, we will be moving to the frontal plane. So we will be working with the side body, with the iliac muscles, the muscle that is inside the pelvis, and gluteus medius, the side body. So for this, it will be like side planks, maybe on the knees, maybe the full one. So the first one, you come on the elbow, make sure that the shoulder will be above the elbow. Option 1, with both knees. As you inhale, you lift the pelvis and you hold it here. You can start with 20 seconds, you can do with 30 seconds, with 40 seconds holding. Or what you can do in the beginning, do the in dynamic move. So inhale down, exhale, you lift the pelvis up. Again, going down, in on inhale, exhale, lifting up. Again, imagine that there is a wall and your whole torso is pushing against the wall. Again, we're not collapsing in the standing shoulder. We're pushing the shoulder away, pushing the fist away. So do maybe 10-15 reps with dynamic, and then what you can do, you can lift here, you can stretch one leg, maybe hold it. So we're not sticking the ribs in, we're holding the ribs in, and we're standing in here. That is training this whole group of muscles that is required. For more advanced option, you can lift that leg. Or if you want to go more intense, you can go to full standing plank with both legs straight and hold it here for 20, 30, 40 seconds, or maybe lifting one leg up. Again, choose your option. Do the same on the other side. Again, making sure that elbow pelvis and knees are in one line. So option with dynamics. Again, with the breath, no rushing. As you inhale down here, exhale, lifting the pelvis. Keep your ribs inside. Inhale, exhale, pushing the floor away. Inhale down and exhale. Then maybe you can hold here. You can maybe elevate one leg, hold it here as well. Imagine that there is a wall behind you, or go into the full version with both legs straight. Okay. Another exercise, which is we will be going into external rotation. We lie down on the right shoulder. My right knee is bent, my left knee is here, my left foot standing. What I'm doing, I'm supporting myself. On the right foot ankle, you can actually maybe put some weights, or just in the beginning start with this way, this one. So you're supporting the knee, you're lying down here. What you do, you lift the ankle up and then down, up, down, up, down. So it's external rotation. It trains the piriformis muscle, and at the same time it trains and releases and stabilizes sacroiliac joint and related to its stabilization group of muscles. So you can do this way, then you can change again, do a few sets with 10 to 15 repetitions on each side. So you lay down. So now I'm lying down on my left side and I am lifting my left ankle even more. If you want to more, you can lean forward and lift this way. Again, hold. And work with this way. One more exercise that is also quite advanced but very helpful to develop mobility around the hip joints and SI joint. We're sitting like a Z letter. So my left knee is in the front, my right foot is at the back, my heel is right close to my right knee. I'm sitting here. What I'm doing, I'm gonna lift my right knee up, down, right knee up, down, up, down, up. So I'm trying to keep my torso the same way. I'm not trying to move, you see, this way. I'm full stable, but what I'm doing, I'm engaging the glute muscles to really push. You can even help yourself to push the knee out and then come back. Push the knee out and then come back. After that, you hold your ankle, you hold your knee, and if you can, maybe lift the right foot completely, but without leaning to the side, right? So if you were here doing the same exercise, you are staying here, but you're working on lifting the side. So you feel the group of muscles this way. So this is medius gluteus. And then we change to the other side. So my right knee is in the front. I am supporting myself with right palm. And again, my all ankles are 90 degrees. So what I'm doing, I'm lifting my left knee, but I'm not twisting, I'm not turning toward it. I'm engaging the group of muscles responsible for external rotation. Let's do 3, 4, 5, 6. You can just move on the heel. 7, 8, 9, and 10. And from here, again, if there is no pain, no discomfort, you work and you try. Lift 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Very good. And of course, we never forget about stretching. So we bring both feet in the front, sitting in Sukhasana, easy pose, and maybe just staying here and just with the torso leaning forward and back, leaning forward to the area where you're not feeling pain in your knees. You feel a lot of stretching is happening in your glutes. So let me show you. Most of the people do a common mistake by rounding the back. Nothing is happening here. What we want to do, we want to keep the heels, you see, in line with the knees. So the front foot is slightly forward. We're staying here, and with the torso, we're moving forward. So we're trying to bring the body, the torso between the thighs, and come up. Again, between the thighs, and come up. Again, do a few reps, like 10, 15. If you feel that you want to stay, you can maybe move your hands forward, stay in here. But trying again, don't go around, try to keep the spine straight, and with the elbows maybe pushing against the knees. So if you kind of opening your chest forward and staying in here, so you'll feel a lot of tension. For the beginners or people who are very tight, maybe just staying here and just leaning forward a little bit will be more than enough, as long as you feel the stretching happening here. And one more, which is very good to stretch the areas that you worked through. We call it a wide butterfly. So the legs are not very close, the feet are not very close. They are like one step forward. And again, you're coming with your chest forward. Again, not rounding in, right? We're going with the straight back. So we're trying to do this kind of straight back and staying here with it. So you can support yourself with ankles, you can support with yourself with the hip. Maybe even staying here for the beginning will be more than enough. And slowly, slowly, slowly your torso will go down. You can maybe even push with the elbows forward, but really try to stretch to keep your spine straight and staying here just to calm the breath. Namaste. I hope you enjoyed that, and if you have any pain, any discomfort, always remind to move with your breath. If the exercise is not comfortable, please leave it for a moment. Find 1, 2, or 3 exercises from this set, practice them, strengthen, mobilize and stabilize the sacroiliac joint and your pelvis and lower back, and then you can move forward with further exercises. Namaste.